We're going to videotape some of this morning, and I think last week we were kind of fortunate. We had some of our patients comment that they had had a good experience and that they might be willing to say a word or two on the videos today. So as we go through, we're going to talk about that. Before I start, I have to recognize that there's a federal law that says that I'm not allowed to talk to each of you or any of you in public. Talking about this. Going through surgery, things like that. And that opportunity is provided to us this morning, but only if you allow it. And so I need to ask your legal permission. And then also put in a caveat to say, you might have something personal and private that you don't want to share. And if that's the case, keep that to yourself. But otherwise, may we have your legal permission to talk to all of mine. The idea there is that there's a tremendous power to this surgery. It is a very powerful transformation of the hormones inside your body, and one of the things it does is it drops your estrogen level tremendously and very rapidly. Now there's a good side to that, because a lower estrogen over the rest of your life means a decreased risk of breast cancer and endometrial cancer, and decreased risk of blood clots and death. So dropping that estrogen is good. But a little bit like the situation if you quit smoking, that's good for you to quit smoking, the less chance of lung cancer and heart attack and emphysema. I just don't want to be near you when you quit, because that sudden drop in estrogen can really hurt. So we understand that and are empathetic to that, and don't hesitate to use more than one patch if you're really.
Jen talked to her today, and she.
Yeah. We had a lady in clinic last week who was really grumpy, and we're trying to talk her into 2 patches, because she hadn't lost much weight yet. And she was just, you know. So if you're out there, boy, I'm in trouble now. We'll go through other patients from last week and talk about their experiences and see if any of them want to actually be on the video. My most difficult and dangerous patient from last week is here. Do you mind, Wilma, may I comment?
Yes, you may.
Wilma's from Canada, and she brought some baggage from Canada, which were very bad lungs. The last time she had surgery, she spent 14 days in the ICU on a breathing machine, because her lungs are not so good. We would say we kid around. You know how doctors kid around? So I'm going to kid around and say, we think you would have a 50% chance of mortality with a haircut.
Yeah.
Delicate.
That's about right.
Right? You're delicate. But you also have a nursing background, so you realize the seriousness of your lung disease and things like that. And during your surgery, your oxygen did drop, and we had to fiddle with the dials on the machines a little bit. But then, you kind of did terrific, didn't you?
Yeah.
I didn't hear you.
Yes.
Just want to make sure that gets on the tape. So you brought to us what we thought was pretty severe lung disease, a history of other previous surgeries that had kind of gone badly as far as respirations and things like that. And with our surgery,
I recovered much quicker than I have in the past.
Pardon me?
I recovered much quicker than I have in the past. Usually I'm flat out for about a week, but this week, a couple days, I was fine. I really think it's the anesthetic, the light anesthetic that you used, and I really am grateful that you operated on me, because I would have been devastated if you had canceled my surgery.
Well, we got a little worried. There was a few minutes there we're going, we don't have to do this. And we were looking at some of the oxygen numbers, and we're going, there's a little beeper that we have. It goes beep, beep, beep. And depending on how much oxygen is the blood, there's a happy oxygen number. That's this tone. Beep, beep, beep. And there's a sad number. Beep, 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 beep. You had the sad number.
I'm pretty sure I would have,
You
yeah.
had the sad number.
I've seen it myself, just in exerting myself, go way really low.
So one of the things our comment was, we feel like we do have an opportunity to help lots of our patients, but we really felt in your case we were really helping you.
Yeah, you probably saved my life.
Well, maybe.
Yeah, I think you did.
Yeah.
I think you will.
I can't
cool.
believe it. Well, I can't. My husband and I walked in, and I mean,
yeah, you're not your husband. Can we say, is it okay to say he's a respiratory
he's
therapist, right?
We were a little worried last week about Wilma, you know, just ourselves. And I mean, when she's just walking and talk, I mean, it makes me want to cry because, and I'm not even all estrogen-y right now, but she could barely walk back here. And I mean, her breaths were very deep, and I think her sats were 88, right? I mean, I just
when
can't
we were,
believe how
I didn't want to
marvelous
say this,
she's
but you
doing.
know, you were blue.
Really?
Yeah.
Yeah.
You
Well,
know, your lips and things
yeah.
like your lips are now kind of
Really?
pink. Yeah.
Oh my goodness.
Yeah. But I was looking at, well, 88's blue.
Yeah.
88, for those of you who don't have, see, we're talking kind of medical here with the nurse and the respiratory therapist and our dentist and everybody. But oxygen can be measured in the percent of hemoglobin that's filled up with oxygen. And most of us, when we test it, are 100% full of oxygen. Many people say I'm full of it, but I take that as a positive. The oxygen in us normally reads 100%. And even a small change is really serious. And so in the 90s, it shows lung damage or problems. But if you go below 90, you kind of, it's... And so your pre-op oxygen saturation before the surgery was 88.
Yeah.
Yeah,
I've been walking around like that for a long time.
I bet. Yeah, but I don't think you'd be walking around like that for
Not
much
anymore.
longer.
No.
Well, this is very exciting for me. I can tell you we're really happy for you. And I guess maybe a brief comment to the rest of the group on how your week has gone.
I was pretty tired the first couple of days. Rested a lot and slept. I have been able to tolerate all the fluids. I have no nausea, no upset stomach, diarrhea once. And I've just been doing really good. And then I was able to start going out, shopping a bit, going to shows. I did use a wheelchair and a scooter to tour the strip. And that was good, but I tolerated a full day out that day. So I'm really doing good. I feel good, and I can actually breathe way better than I could last week.
Can we take your staples out?
Yeah.
You want to do it on TV or
Sure,
not?
if everybody wants to see my bruised abdomen, they can do that.
If it's too bruised, I'll cut it out so it won't appear. I'll put in Cindy Crawford's ad.
Okay, you do that. Yeah.
Let's see, here we go.
I bruise easily, by the way, so it really wasn't him. I bruised giving myself an insulin needle.
What's the latest sugars?
It was 12.7 this morning.
So still a little up.
Yeah, and blood pressure was up, but I was rushing around packing and everything, so.
So you keep on your blood pressure and that is.
Yeah.
How much insulin did you take last night?
I didn't take any last night. I took 5 this morning. And I took a blood pressure pill this morning. It was just pretty exciting. Yeah, I took some.
Applause.